back. Hi, I'm Kayla. I'm going to wash my hands. I'm a student nurse. I'm here to do a newborn assessment on your baby. Just kind of go head to toe and make sure there's nothing wrong. I'm just going to check the baby's wristband, and I'm just going to compare it with your wristband, okay? Awesome, looks good. And then I'm going to make sure the baby's in a warm environment, so either in a warmer, or I would use warm blankets on the baby, okay? And I'm going to start with doing the apical heart rate, and the apical heart rate would be 120 to 160 beats per minute. And after I'm done with the heart rate, I'm going to do the respiration rate. So that would be 30 to 60 breaths per minute. And as I'm listening to the respiratory rate and heart rate, after I would be listening to the lung sounds. So I would listen to the heartbeat for a full minute, the apical heart rate, and then I would go down and listen to the respiration rate, and then I would go up and listen to the sides for the lung sounds. And I can also assess baby's abdomen during this time, so I can do my bowel sounds starting in the right lower quadrant and working my way up, making sure that it's active in all 4 quadrants, and I can also assess the umbilical cord while I'm here. And you would want to inform the parents that to not cover it with a diaper, and keep the area clean. Don't use any alcohol swabs on it or anything. And if you notice any foul smelling or a yellow discharge, to call your pediatrician, because that's a sign that it could be infected. You want to make sure it's clamped and let it fall off on its own. Don't try and pull at it or anything. Going back to respiratory rate, it's normal for them to have an irregular breathing where they stop for 5 to 10 seconds and then go back and have rapid breaths afterwards. And then 4 signs of respiratory distress are nasal flaring, retractions in the substernal or intercostal, where you can see that rib cage kind of going up, circumoral cyanosis, so the blue around the mouth, that's probably a further sign that there is respiratory distress. And then tachypnea, or a rapid respiratory rate over 60 breaths per minute. And then I would then go and check baby's temperature. I do axillary under the armpit, and I'll go right under here and hold baby's arm down, and I'm trying to get it in between 36.5 degrees Celsius to 37.5 degrees Celsius. And babies usually don't like it when you do that. They get a little angry. So, and then I would then look for baby's posture and their movement. Usually you don't want them to be flaccid where it falls down. Usually they're kind of clenched up, because that's how they were in mommy. And then just looking for any signs of tremors, if you will. And then also we're looking at the skin color. Most babies after 24 hours will be pink, but you will notice some acrocyanosis in the hands and feet, because the baby's circulatory is kind of going more to the lungs, kidneys, those vital organs that it needs to sustain life for the first 24 hours out of mommy's womb. And then you can also look for signs of jaundice. So you can do that by kind of pressing on baby's nose, and if it's white, then that's a good sign there's no jaundice. If there's yellow tinge, that means that's the sign of jaundice, so the bilirubin is high. And if you see that within the first 24 hours, you'd want to contact the pediatrician, because that's not a good sign. And then after that, I would assess their head. So I would look at the front, feeling the soft open of the anterior fontanelle, and then the posterior fontanelle, and then I would feel for the sutures. It's common for overriding or to have them approximated. And you just don't want the fontanelles to be bulging or sunken in. And along with that, you can see for the cephalohematoma, which is the blood that gathers underneath the skull, and the caput, that is the swelling, so fluid buildup underneath the skull from being kind of pushing out of the vaginal canal. And then I would go down to baby's clavicles and just touch from outside in. Notice any signs of crepitus, because that could be the sign of bone fractures. Noting any masses. If you feel a bump on one side, just hope that it's on the other side, and if it's not, then that's something to let your pediatrician know. And then I already talked about the abdomen and bowel sounds. You want to make sure the abdomen's soft and round. If it's firm or distended, let your nurse or doctor know. And then we're going to look at the back. So we'd hold baby like this, and we just assess the back for, you want the, the vertebrae to be in a straight line. And then you're looking for the pyramidal dimple, I probably botched that, where the spine meets the crack of the butt. It's just like a dimple. Some children are born with it. It's something that can go away over time and nothing to be concerned about. And then you can pull back the diaper, check the genitalia. For a female, you would just, the labia majora and minora should be seen. For the males, you want to make sure that the meatus or the urethra is at the tip of the penis. It can be off-centered, so just let your doctor know if you notice that. And then you would check for the scrotum and then the two testes that are there's small little seeds up there. And then we can go on to the reflexes. So you can do like baby startle reflex or the Moro. You can grab onto baby's hands and get the grasp reflex and see if they would, grab onto your fingers. You can rooting from the side. And if you root, and so when you touch their cheek, and they should bring their mouth to it as a form of them trying to like suck on like the nipple almost. So you do that on both sides. And then you have the Babinski, which you would take the outside of the foot and go like that, and their toes should spread out like that. And then the stepping, where you would stand them up like this and they should make a couple steps. And then for teaching, how to tell when your baby is eating enough when they're being breastfed. You just want to keep an eye on their input and intake and output. So they should be feeding 8 times within 2 to 4 days of birth when the milk comes in. Baby should be having 6 wet diapers after 24 hours. The weight loss is normal for the first 3 days. It's normal to lose 8%, but any more could be a sign that they aren't eating enough. And then they should be able to regain that weight back. Having stool diapers 4 times, 24 hours every 24 hours after the 3rd day would be normal. So if you have any less diapers, then like less stool diapers, and they're probably not eating enough. And then how often a baby should urinate. Within the first 24 hours, they should at least urinate once. From 24 to 48 hours, they should have, 24 to 72 hours, they should have 4 to 6 wet diapers. By the 4th day, they should have a minimum of 6 wet diapers. So I think I misspoke when I was talking about their urine output for how to tell if they're eating enough. So baby should have 6 wet diapers after 72 hours, every 24 hours. And then for stool, they should have at least 1 stool within the first 24 hours, and that's the meconium stool, and then that will continue into the 2nd day. And then by the 3rd day, they should at least have 3 stools, and that's the transitional stool. By the 4th day, they should be having 4 or more stools within that 24-hour period, and those are called milk stools. There are 4 signs that you'd want to note to report to your pediatrician. Is the axillary temp over 38 degrees or 100.4 degrees Fahrenheit, because that could be a sign of infection. If baby is flaccid, so their arms are just going right back down and they're hard to arouse, so if you tap their foot, they're not responding. Any new rashes that you aren't familiar with and that they have educated you on that is normal, you'd want to indicate to your pediatrician. And then vomiting, whole feeding more than 2 to 3 times in 24 hours. And when your baby, if you think that they're choking, you'd want to grab them and make sure you're supporting their head. Put them on your arm, kind of face down, and make a fist and just go and just kind of do like some thrusts, back thrusts, until you see the object come out, or you can sweep it out. Don't do a blind sweep. And then for safe sleeping at home, when you get home, just do the ABC. So you want the baby alone on their back in the crib. No extra blankets. A sleep sack is probably your best bet. It keeps them warm, but it's also not adding extra layers. No bedding on the side of the crib or anything. Just ensuring that they are just alone in the crib and not with other people in a bed. And then before I leave, I would want to offer baby to mom for skin to skin, because that helps regulate their temperature, and it just kind of helps bond them more. And if they want to be with mom, I'd give them to mom for skin to skin. If not, then I would place them back in their bassinet alone, just safely, and just ensure that they are safe before I would exit the room. Thank you.